Hi, my name is Jen Dahlke, and I work as a certified lymphedema therapist at the Winnipeg Regional Health Authority Breast Health Center. I am one of 2 therapists that manage lymphedema at the center. This section of the program is on lymphedema. Lymphedema is a condition that can occur when the normal lymph flow becomes impaired and lymph fluid starts to accumulate. It is a chronic condition that can happen to your body after you've had breast surgery. It is impossible to know for sure who will and won't develop lymphedema, but it is a condition that can be managed with proper care and maintenance. Studies have shown that patients who undergo surgery with lymph node dissections tend to have a higher risk of developing lymphedema. Let me explain. Your normal lymph flow can become impaired after the removal of your lymph nodes after radiation or with trauma or injury to the lymph vessels. As a lymphedema therapist, it is my job to stimulate your lymphatic system and help your body move excess fluid from the affected area. Signs and symptoms of lymphedema include swelling or edema on the surgery side. The areas that could be affected are your arm and/or hand, your chest, armpit, and trunk. Patients with lymphedema feel heaviness, tightness, aching, or fullness in the affected area. Your clothing and/or jewelry will feel tighter. The tightness of your clothing and jewelry may be a good determinant of increased swelling. Pay attention to these changes and seek medical advice if you feel any changes. I am now going to demonstrate some stretching exercises you can do after you've had your surgery. It is important to start doing stretches and exercises immediately after surgery to encourage mobility, reduce pain, stiffness, and improve your overall well-being. The exercises that are demonstrated in this presentation are gentle and should be done in the first week after surgery. While performing the exercises, make sure that you take deep breaths and the movements are slow and controlled. It is normal to feel a gentle tissue stretch or a slight pull of the skin. First one that will be performed is shoulder shrugs. Shoulder shrugs can be done sitting or standing. Start with your shoulders in a relaxed position and slowly lift them towards your ears. Hold for 5 to 10 seconds. Then slowly lower your shoulders and relax. You can repeat this exercise 5 to 10 times. Next exercise is shoulder rotations. This one helps to increase circulation in your shoulders and promote good posture. Start by slowly rotating your shoulders upwards, backwards, downwards, and then relax in the position you started in. Repeat 5 to 10 times, then switch directions, moving your shoulders in the opposite direction. Forward shoulder circles begin with your shoulders moving upwards, forwards, downwards, and then relaxing in the position you started with. A great way to improve your posture is to do this next activity by simply squeezing your shoulder blades together. This movement stretches and opens up your chest area. To properly contract your shoulder blades together, keep your shoulders down in a relaxed position with your elbows straight, extended, and palms facing your sides. You may want to try this in front of a mirror so that you can make sure that you have proper position. Contract your scapula together and rotate your palms so they face forward. This motion will naturally bring your shoulders in an external rotation. Hold this movement for 5 to 10 seconds and then relax. Arm lifts can be done sitting or standing. Hold your hands together in front of you with your elbows bent in a relaxed position to start. Slowly lift your arms upwards until you feel a gentle stretch. If you have any pain or tenderness, lower your arms until you can comfortably perform the exercise. Hold for 1 to 2 seconds and then slowly lower your arms until you're in the starting position. Same as the other exercises, you can repeat 5 to 10 times. One of the best things you can do is buy a small, soft, squishy ball. By squeezing this ball, it may help to reduce swelling and improve circulation by encouraging the pumping action by the muscles, not to mention act as a stress reliever. If you are sitting or laying down, relaxing, squeeze the small ball several times, as easy as that. These exercises should be done within your pain tolerance, and remember to take deep breaths while doing them. In the early stage of healing, it is recommended to not lift anything heavier than 10 pounds. Avoid activities that require you to perform vigorous, repetitive motions like vacuuming or shoveling snow, or reaching high on your surgery side. Take it easy and prop your arm with pillows for comfort and to allow yourself to heal. The next set of exercises demonstrated encourage full range of motion in your shoulders. It is important to start these stretches as soon as possible after surgery to prevent possible issues with mobility in your shoulder on your surgery side. If you have had a drain inserted, wait until the drain has been removed to begin these stretches. I'd like to start with wall walking. It is a gentle exercise to increase the mobility in your shoulder. Stand facing the wall at about an arm's length from the wall. With your elbows straight, start from your hips, slowly walking your fingers up the wall as high as you can. Make sure you are not just bending your elbows, but that the movement is coming from the shoulders. Walking both hands will help to maintain good posture. Hold for 5 deep breaths, and then take one more deep breath and try to walk your fingers a little further up the wall. Then slowly walk both arms down. Relax and repeat several times. Do not be discouraged if your progress is slow. One finger at a time is progress. Next, we will perform wall walking in a different direction to our side. Stand sideways with your shoulder facing the wall. Start from your hip, slowly walking your fingers up the wall as high as you can. Remember to try to keep your elbows straight. If you feel pain, then slightly lower your arm until the stretch is not painful. Hold for 5 deep breaths. Then take one more breath and try to walk your fingers a little further up the wall. Then slowly walk your fingers down again. Relax and repeat several times. If you're having trouble with your mobility, try repeating these exercises 2 to 3 times with several repetitions throughout the day. The next 3 movements could be done seated or standing. They are similar to the wall walking movements. Start by raising your surgery side arm out to the side as high as possible. Keep your elbows straight and hold for a count of 10, and then slowly lower. You can repeat this exercise several times. Remember to take deep breaths while performing this stretch. The next movement is similar to the previous one. You will slowly raise your arm forward as high as possible, keeping your elbows straight. Hold for the count of 10. And then slowly lower. You can repeat this exercise several times. This next movement will provide a stretch in your pectoralis muscles. These muscles are located in your chest area and can feel tight after breast cancer surgery. To do this stretch, you should be able to comfortably place both hands behind your neck. Begin with both elbows pointing forwards. Slowly move your elbows out to the sides as far as possible. If you're standing against a wall, try to touch your elbows to the wall behind you. Hold for a count of 10. And return your elbows pointing forwards, and then relax. The last stretch I'd like to include, I call the back scratch stretch. This stretch is to help you with the motion of scratching your back or doing up your bra. For this stretch, you can use a towel to assist the movement and increase the stretch. To do this stretch, you should have fairly good mobility in your shoulders. Start by holding on one end of the towel in the hand of the side you want to stretch. Start by holding a towel up in your surgery hand. Grab the bottom end of the towel with your non-surgery hand. Gently pull the arm down your back by pulling on the towel with the hand that is below. The motion should appear as though you are trying to dry your back. Take deep breaths while holding the stretch, and after holding the stretch for a minimum of 30 seconds, try to increase your range by gently pulling the towel further down your back. Slow and controlled. Change the hand positions and gently pull your arm up your back. If this motion is challenging, you may want to start by placing your hand on your hip and slowly moving it up towards your mid-back. If you want to use a towel or need to increase the stretch, gently pull on the towel with the hand that is above your head. Repeat this stretch 2 to 3 times per day as needed. You should continue the exercises until you have regained full movement in your shoulder. If you're having trouble with mobility on your surgery side, contact your nurse or doctor who may refer you to one of the Breast Health Center's lymphedema therapists or a physiotherapist. I encourage you to attend our post-op session or view the post-op DVD or online link as I go into detail about lymphedema and our program at the Breast Health Center. Instructions for the stretches demonstrated, along with our pamphlet, Your Guide to Breast Cancer-Related Lymphedema, are available online at wrha.mb.ca/BHC in the Client Education and Resource section. If you would like to find out more information about our lymphedema program, you may contact a certified lymphedema therapist at the Breast Health Center, 204-235-3684 or 204-237-2034. Thank you.